Hi, this is Pamela Wirth with the Hello Health podcast, and today I have Caleb. Caleb, you built Apex Regenerative to deliver the highest potency placental-derived exosomes available. Um, there is so much impressive results and things that can be done with inflammation, with disease, and super excited to have you here.
Thanks so much, Pamela. Thanks for having me. I'm excited to be here.
So, just to kind of start it out, I've been taking my mom down to Mexico for her cancer treatments um, for, I guess, going on 3 years now, twice a year. And what I learned when I was down there, because I'd heard a number of stories about good or bad, ozone IVs, stem cell IVs, and I met with several doctors down there, and I ended up doing it myself, and I felt fabulous. Um, and would love to, understand a little bit more about how you're using them, when people should be thinking about, do they optimize their hormones first? Do they introduce peptides? Should they be thinking about stem cells? Like, how does all of this come together with all of your experience and kind of next steps when people are thinking about this, no matter what age you are?
Sure. That's a large topic, what you're just introducing right now. And so, what I want to hone in on is on the stem cell, so the cellular biologic regenerative side. And that's the main thing that we do, right? Is as you mentioned in the intro, placental and umbilical derived mesenchymal stem cell exosomes from 0 day old live tissue sources. And so that means taken after a healthy full term delivered pregnancy. Here in the US, we use FDA and American Association of Tissue Banks, AATB, accredited tissue processors to take that donated tissue on the same day, get the mesenchymal stem cells direct from that tissue. Those are the most potent, most regenerative cells that the human body ever produces. We get those cells that day, elicit the exosomes from those cells. Exosomes are secreted from every cell, including mesenchymal stem cells. The exosome is the information carrying microparticle that comes out of the cell. It is, we now know, how stem cells and other cells, but specifically stem cells, do their healing work is by secreting these tiny particles that carry all the proteins, growth factors, and regenerative signals. All the good stuff that does all the healing in our bodies is carried by the exosomes. We get the most potent cells and most generative cells that the human body ever produces, take the exosomes from those cells, leave the cells, and there's a reason for that, leave the cells. And then what we're able to do is through a variety of modalities, whether it's IV, and I say when we providers are able to, here in the US, distribute them through IV and IV push systemically. That's incredible. We have a sublingual spray under the tongue and intranasal spray, which is incredible for any skull-based or brain-based degenerative or inflammatory conditions, any degenerative or inflammatory condition. And then, of course, topical and sub-Q and intra-articular or intratendinous, so in the joint or in a tendon, an inflamed or degenerated tendon or joint. And wherever they're put, they seek out any deficit from perfect and start repairing that deficit. The last thing they've done, their last job prior to coming into your body, was to create an entire, to process everything that was needed to create an entire perfect human being from 2 cells, right? That's what these cells have just been tasked with. When we get them in massive quantities and are able to process, package, and deliver them to you. So when they get into your body, they do the same thing. They carry all the healing and generative instructions for every tissue type in your body: brain tissue, nerve tissue, muscle tissue, heart tissue, lung tissue, respiratory, pulmonary, eyes, all the inner ear, your joint components, all those things, they have the generative potential to regenerate those things. And that's what they start doing.
How
So,
do you recommend somebody to do this, and what sorts of things would you encourage people to start with? Whether it's I've heard about it in terms of autoimmune illnesses. I've heard about it in terms of autism. I've heard it's not good for cancer because they can potentially make cancer cells replicate faster. But tell us a little bit about your patient base and what they're using it for.
Sure. So we've now, in the last 3 years, treated almost 13,000 patients here in the US. There is hundreds of thousands of patients in the last 5 years in the peer-reviewed literature, so recorded in peer-reviewed studies, hundreds of thousands. Last year, we did about 10% of all exosomes in the US were done through our company, Apex Regenerative. And so, we've got a good idea of the types of conditions that this can work with, stop, and reverse. As you mentioned, they're degenerative and inflammatory. Autism is an incredible one. All of the brain-based, dementias, right? Vascular dementia, Alzheimer's is about 70% of all dementia in the US. So incredible in Alzheimer's and Parkinson's and all the orthopedic degenerative conditions, right? If you're bone on bone, knee or hip, osteo or rheumatoid arthritic, bone on bone, knees and hips respond incredibly well. And typically, what we're doing is a protocol, and it's a protocol that may include an acute delivery via injection. It may, the majority actually don't because the majority end up being a systemic protocol where that could be an IV with daily sublingual for 60 or 90 days. That's very common. Another thing that we do is we manufacture the only intracellular NAD supplement. So NAD is the only molecule that fuels all of your cells. It's kind of the cellular battery pack is NAD plus. Many people are familiar with NAD supplementation, getting it via an IV or intramuscular injection or even an oral supplement. All of those commercial versions simply raise your blood plasma NAD levels. That doesn't raise your intracellular NAD level, which is what powers the cell. So when you get an NAD IV or an NAD intramuscular shot, it temporarily raises the NAD in your system until your body flushes it out. And when you get an NAD IV, there's a plaque enzyme response that flushes the NAD out of your system. People feel that as arrhythmias and they'll sweat or feel nauseous, right? And you have to slow down how much NAD you're taking as an IV. That's because it's hitting your blood plasma levels and increasing in your body. We have the only intracellular NAD. When you take it orally, you can take it at a clinic or you can take it yourself from home in a 60-day cellular reset. It only raises your intracellular NAD 53% on average in 5 days, 300% or more in 60 days. And so I mention that because those are two foundational elements. I'm 50 years old. By the time I am 50, my NAD level, my cellular battery pack in all my cells has dropped at least 60% from its peak when I was 17 to 20 years old. So my cellular energy has dropped. I can reproducibly increase my cellular energy 300% in 60 days with our proprietary, it's called lathmized NAD. So we raise the cellular energy, then use exosomes to direct those newly powered up cells where and how to heal. It's the healing instructions, the healing blueprint is what we deliver systemically, usually with one or more IVs that deliver this incredible bolus of the most potent exosomes, which are the placental-derived. We give a bolus of that, and just that has an incredible anti-inflammatory and systemic healing effect. It's made 20 to 30% more effective by daily sublingual spray under your tongue from home that delivers about 10 billion umbilical-derived exosomes daily. Again, from home, out of your refrigerator. So when we combine those two things, that is the start of most of our degenerative protocols, chronic and acute degenerative protocols, is IV and sublingual and LNAD in some combination and potency based on condition, duration, and severity of the condition, right? So we'll play with those based on what's in the peer-reviewed literature, what our experience has been over 13,000 patients, and just what we see, what makes the most sense. We have protocols for each of these conditions, and what we reproducibly see. For instance, with 1 week of our typical degenerative protocol, which is one IV and 6 days of sublingual, we see a 500 to 1,000% reduction in total body inflammation. And so this was done in a cohort of type 2 diabetics with no other lifestyle changes from, in the 50s to the mid 70s age. And we were doing these protocols, measuring pre-IV and then measuring on day 7 after 6 days, after one IV and 6 days of sublingual. So that was essentially week 1 of 60-day or 90-day protocol. And in those type 2 diabetics, we saw their SED rate, their ESR, going from the high 100s or low 200s to the high teens or low 20s. So a SED rate of 210 a week later with no other lifestyle changes or pharmacological change, a week later, an ESR of 210 was now 17 or
Which,
19.
which markers are you testing exactly when you're testing inflammation? Just kind of for curious people that are like, okay, so I want to kind of measure where I'm at.
Yeah, so ESR is one that is very commonly done. If you get a normal blood panel, that is a very standard panel. It doesn't measure specific areas. It is a total body, kind of very broad, the most broad measurement of total body inflammation. Another one that we measure is HSCRP. That is the most discriminating measure of total body inflammation. It's an incredible marker of heart, kidney, and liver health. And when that is high, that's bad news. Kind of looking forward for those organs, and so those are two that we really encourage. The ESR is the easiest. CRP, you're going to have to specifically ask for that. But ESR is the easiest. And that was the one that showed that 500 to 1,000% reduction in 1 week. And so we knew, that was a year and a half ago that we were getting those measurements. And so we had at that point almost 2 years of experience seeing patients' response, right? And the main thing that we saw when we first started off, we were doing mainly orthopedic injury, right? You had a degenerated knee or hip. It was inflamed. It was potentially bone on bone. And we started mainly doing just injections. We really saw incredible results when we coupled those injections with systemic use and then even started not doing the injection and getting still incredible regenerative results. But what we would see at the beginning when we were doing the initial systemic with the acute intra-articular injection, people would have their joint pain in their right knee, and their right knee pain would go away, as would their left knee pain. And the swelling in their second knuckles would go away. And then their psoriasis that they'd had for 3 years that they were doing steroid cream every day for would go away, right? There would just be this massive anti-inflammatory response where when we took away that inflammation and we didn't at that point know how much we were reproducibly taking away. Now that we know it's 500 to 1,000% reduction, it totally makes sense, right? This is the response to expect.
Yeah, so I love that. So what you're saying is for orthopedic, for instance, you don't necessarily have to depend on doing injection after injection.
That's
You
right.
potentially do an IV with the injection, with the sublingual, and it just continues this path of recovery.
That's exactly right. There's acute inflammation, right? Inflammation is the body's alarm system that says, bring healing here.
Mhm.
And so that works when your total body is not inflamed. That works to have some inflammation in one part that needs healing. And then the body can rush your own natural healing capacity to that area. Well, when we have a low or medium grade inflammation throughout our entire body, we've totally overwhelmed our body's healing capacity. And so even the things that should heal, that would have healed if we weren't inflamed, can't heal. Even if we had the regenerative capacity to heal that one thing, the number of things that aren't healing keep piling up.
Yeah.
one on top of the other. And so it's really, that's one of the most gratifying things is when you take away that total body inflammation, ultimately what we're doing and what we can do reproducibly is the aging process is when degeneration overwhelms your body's gross regenerative capacity,
Mhm.
right? When you no longer have the regenerative capacity to overwhelm the degeneration that you have genetically, that you give to yourself, and that is in the environment, when that time comes, you are now aging, right? Because your degeneration is overwhelming your regenerative capacity. We can reproducibly raise your body's gross regenerative capacity until it outstrips your degeneration, just like it used to when you were a kid. That's what our protocols are doing. And because of that, even in the last 6 to 9 months, we've got about 30 NFL and NBA guys who are kind of maybe they were at the end of their career, long time career, and now they're doing these protocols. Incredible elite athletes, just kind of the top of the top. It's not just for them, it's just for that group, their body and degenerative and regenerative capacity is their lifeline. That's their entire business. And so, of course, they want to do that. Well, there's so many others that are weekend warriors like me, people that just want to be active. We can reproducibly raise your regenerative capacity until it outstrips your degeneration, like it did when you were a kid.
How often do you encourage people to follow this protocol? Or, I mean, obviously it'll differ between somebody who's an elite athlete versus a 40-something-year-old mom who's exhausted and her hormones are probably on the verge of changing, her kids
Yeah.
and work and everything else. I mean, what do you kind of suggest in terms of something?
Yeah, some of our most popular are 60 and 90-day protocols. Those are usually IV heavy at the beginning. So it might be, a 90-day or a 6 month protocol where you start with kind of a bolus of IVs to get you going, get that regenerative process going. Again, up your total gross regenerative capacity. And then once you've started that and gotten it up, then we're maintaining it. And so, kind of, we have a what's called our superhuman protocol is doing at least one IV a month, daily sublingual and daily LNAD plus. So daily intracellular NAD. You do that again more at the beginning, kind of loading at the beginning. That 60-day time period when we can reproducibly get your intracellular NAD up 300% compared to baseline, then we can maintain that with a maintenance dose. So both of them, both on the raise your intracellular power and on instructing those powered up cells where and how to heal, we do that kind of a big amount on the front end and then maintenance dose.
And then do you require people to come into your clinic or your office to do this?
So we're the manufacturer. We're based in Austin, Texas. We, of course, work with preferred providers throughout Texas, throughout the nation. We're largest, of course, here in Texas, in Southern California, in South Florida, but we work with providers nationwide. Many people, because it's efficient, to work directly with the company, will come straight into Austin and work with our preferred providers in Austin. Lots of times they'll do that over the course of a long weekend, for instance. Austin's not a bad place to visit. And so they'll do that over maybe like a Thursday to Monday and start that first week of their protocol, especially if it has to be administered intraarticular or intratendinous with an injection, then they'll do that, and come into Austin. You don't have to. Some of the things that we can do also can be direct to patient, like sublingual and intranasal can essentially be direct to patient after we work with the provider. And that's efficient. LNAD plus, the raise your NAD level, can go direct to patient, and that's available worldwide.
That's cool. You hear stories about how long stem cells can live or exosomes. Can you kind of touch on the life cycle of each and what's normal, what's not normal? Because you hear stories from different people and they probably enjoy hearing it from you.
Yeah, that's a great question. So the main thing, I think the main misunderstanding that people have, and it's based on a mental map that we all had about how stem cells worked, how they healed in the body when you took them in as a transplant, whether they were your own stem cells, which are called autologous, or they were stem cells donated from somebody else, which are allogenic. Whether autologous or allogenic, when you get stem cells into your body, we could show that they were alive, right? We could show that they were a certain type of stem cell. So we knew that, and we know that now. You can for sure verifiably do that. Previously, for the last 20 years, up until the late 2010s, right? So 2015, 2016, and beyond, in that time previous, we thought that stem cells got into your body if they were the right types of cells and you created the right environment, that they would engraft into your body, continue to duplicate, and eventually turn into the source, the native material that you were trying to replicate. So if you put it into a knee, they would engraft around the knee. And eventually, if you had the right types of cells and the right type of environment, and fingers crossed, it all worked together, that months later, that would turn into new cartilage, for instance. We now know that is not what happens at all. We now know that 99% of stem cells, whether they're autologous or allogenic, 99% at least die or are flushed by your body within 24 hours. The ones that don't, the 1% that survive, don't survive longer than 72 hours. So that is, there's hundreds and hundreds of papers that show that. The creator of stem cells, a guy named Arnold Kaplan, Dr. Arnold Kaplan, in 2018 wrote a study saying that what were called that he named mesenchymal stem cells should instead be called medicinal signaling cells, because they didn't replicate, they didn't engraft, they didn't turn into new tissue, they signaled. The main mechanism of action for how they work in that 24 hours that they're alive is they secrete signals, i.e., exosomes. So they are expensive exosome carriers. Expensive, fragile stem cells are expensive, fragile, potential genetic load, bacterial and viral load carrying exosome carriers. So we completely cut that middleman out. Stem cells are also very inflammatory. If you get them from your own body or if they're donated, they're also very inflammatory. If you get a stem cell injection, they'll tell you, hey, days to weeks to expect inflammation for days to weeks. Exosomes are totally anti-inflammatory. They carry no inflammatory signals, just the opposite. And so that can actually be a meaningful safety difference. You hear, unfortunately, about people having an anaphylactic response to cells. Well, it's because the cells are capable of carrying things that can create that response. Exosomes are incapable of carrying those things. And so significantly safer, significantly more concentrated and healing. And we now know they are how stem cells work, is through exosomes. So that's kind of a watch out for people. If you're going and getting stem cells, ask the provider, what is the idea around what these stem cells are going to do? Tell me in simple terms what they're going to do. What's the value when we're putting this in my knee or my shoulder or my hip, or when you're giving it to me as an IV? What do the cells do? You know, and what you likely will hear is, again, nothing against these providers. They're just regurgitating something that is a 10 to 15-year-old mental map of what we thought stem cells did
Mhm.
10 to 15 years ago. And it is not the case. What they do is, for a very short period of time that they're alive, they release these healing signals. And that's their value. That's why people can get a good result from stem cells. Even though they die within 24 to 72 hours, you can still get a great result because in that time period, they release signals.
Mhm.
And your body needs those and will eat them up, and that will start a regenerative cascade. We go straight to starting the regenerative cascade immediately with no inflammation.
Well, thank you. Um,
Mhm.
so when people want more information, we've got the apexmedical.com. Is there anything else that you want to add
Yeah, would love for people to connect with us on all of our socials. So that's IG, TikTok, Facebook. We're at Apex Regenerative on all of those.
Awesome. Thank you so much, Caleb.
My pleasure. Thanks so much for having me.